My name is Dr. Michelle LeBlanc, and I've been doing AAT for the past 11 years. It all started when my daughter was 5 years old. She was born with eczema. And by the time she was 5, she couldn't have sugar. No contactants could be on her skin. She couldn't have nuts. She couldn't have dairy. And I started doing treatments on her. I found this as an alternative solution other than rubbing steroid cream all over her body starting at 2 years old. So AAT has definitely changed my life personally and professionally. Before using AAT expert systems, I had patients that would tell me that they had allergies, but they didn't know what to do with it. I would try and do adjustments, but that wasn't always a help, especially if somebody was sensitive to food. And then they would just tell me how they were on allergy shots continuously, years, and it still was not helping. So really, other than listening, I didn't really have any other advice to offer patients when they came into my office. I didn't really try anything before. I pretty much was chiropractic based, did physical therapy on the chiropractic side, adjusted the spine. But other than that, I didn't do anything for allergies or sensitivities to the patients that came in. Our results from using the AAT expert systems has been phenomenal. Just this week alone, I've treated a little kid for mosquitoes. I've treated patients for barometric pressure and air change for rain, stuff that is not your typical norm like dairy or gluten or dust and dust mites, but it's definitely changing the way I practice. I'm incorporating chiropractic and AAT, almost like a double-edged sword to really help patients get better. My practice has changed using AAT expert systems because I can charge cash. I don't have to worry about health insurance, filing the health insurance. So it has increased revenue. The type of clients I'm attracting into my practice from AAT are ones that may not necessarily need chiropractic care, but they've heard from another patient that it can help with the sensitivities. So those people would have never walked through my door because maybe they don't have a chiropractic problem, but with the sensitivities, that's when they're walking in. And a lot of times too, once I speak to them or start doing the AAT treatments, if they do have any chiropractic issues, then they know that they can continue to stay with me and get that kind of treatment also. For me, AAT therapy, I found it was a little difficult to learn only because I didn't do a lot of kinesiology in my office. DeBritt was fantastic as a teacher. I thought it was a lot of information and a little bit of time, but you just have to keep doing it. The more you do it, the more you get better at it. And then it's just secondhand. It's like anything else that you practice. So you just have to keep doing it and you're going to make some mistakes, but you're going to have a lot of wins and it just all works out in the end. I would recommend AAT to other practitioners because it is another form of income. It's a way to get patients in your door that maybe would never even know about you. And one of the few people in your area that's doing AAT, you're going to get people that's going to travel to you. So a lot of times if they're having sensitivities and they're coming to me from 30 minutes away and they're looking for a chiropractor, I could kill two birds with one stone. I could treat them at the same time for both specialties. So it's going to bring people in. Plus, you're going to be a better resource for the patients that you have because you're going to give them hope. You're going to offer them different solutions other than strictly medical and allergy shots that we know does not work. You're offering them food options that there is no options for them other than avoidance. So it will open up different doors if you become an AAT practitioner.